we haven't talked about as much. I certainly have not seen it in the media, but I think we want to lift it up. Is as much as this is an ideological, we don't like trans people, we think that feminists have gone too far, we don't want certain communities, of color to have certain levels of access or protection. This is also and I'm not a conspiracy theorist, I always like to say, but I'm not a coincidence theorist either. This is also, when it comes to the medical and public health side of things, a huge corporate boondoggle. This is going to result in, right, the only quote unquote available research being corporate driven research with very few guardrails, with very few boundaries, right, without some of the protections of academic science and academic medicine, not just human subjects, but certainly some of the protections in terms of side effects we can think about if we're talking about medical kinds of interventions, that get tested and other kinds of things, and very limited legal protections for those who might be negatively impacted, right? But we could also think about just the very production of certain medicines and how, again, depending on what you're using in those medicines, they may, in fact, in mass production, cause huge environmental kinds of runoff, may have all kinds of other downstream effects, literally downstream effects that are not necessarily protected because you're allowing corporations to kind of drive the scientific research to cherry pick results, right? So when you start to attack the FDA, when you start to attack some of these other government agencies. And so I think that's something that I'm grappling with, but I also have not had community to really talk about because it's not being talked about as much as the other piece of it, right?